Joining us right now is Dr. David Levy. Dr. Levy is an epidemiologist and the CEO of EHE Health. That's a national healthcare provider to big companies like BNP Paribas, IBM, and Lockheed Martin. And Doctor, welcome this morning. We have a lot of questions for you. We want to ask about how we can really start attacking this virus. But first, there are so many concerns this morning about this new strain that seems to be more contagious, 70% more contagious in the UK. As an epidemiologist, what can you tell us about this? Obviously, a lot of questions, but what are you thinking?
Well, thanks for having me on this morning. I know the news is concerning about this new virus, this new mutant, but looking at the data, it appears like it's a little bit more transmissible. They say that the transmissibility factor went from about 0.8 to 1.2. It's probably been around a little bit longer than most people think, and likely a lot of the increased transmissibility has been due to human behavior. But I just want to say that this really focuses much more the need for us to get going with our immunization program. Science has given us an unbelievable silver bullet, and if we continue to focus on what we need to do here in this country, we can get over the situation with these ongoing mutations as they come through.
Yeah, God bless. Let's talk a little bit just about the math behind some of these things. The mortality of the COVID virus versus the regular flu. Explain that to us.
Right. So to get a macro perspective on what we need to do, one has to understand what the math of this epidemic looks like and what the lethality of the epidemic is. The lethality of the current coronavirus is probably somewhere in the range of 0.5 per thousand. A regular influenza epidemic is something like 0.08. We know now all over the world, particularly in America, that about 80% of cases are in people over the age of 65, and another 15% with people with what we call comorbidities, hypertension, lung disease, diabetes, and the like. Simple math says that if you can focus and get this vaccine to all of those people, there's about 50 million over the age of 65 and 50 million of the other comorbid conditions, the vulnerables, you can drop the lethality of this epidemic in fairly short order down to what a traditional influenza-like epidemic looks like. Now, that's not a cure, and that's not eliminating the entire virus from society, but it dramatically pulls the rug out of the lethality and frankly has huge amounts of positive impact all over society by reducing that lethality. And that's what we need to focus on over the coming weeks.
Hey, doctor, I don't know if this really is part of what you do as an epidemiologist, but so these mutations seem to be in the spike protein, so I understand how it makes it more contagious. Where does the lethality of the virus reside? It's a lot of it is your body's overactive immune response. We see that horrible cascade of like an autoimmune reaction in some of the cases of death. But would it be possible to see a mutation in what causes the virus's lethality instead of its infection rate? Where would that be? Where would that mutation come from?
Well, it's unclear exactly the entire pathophysiology, what we call, of the virus, exactly how it does all of its damage. But the thing people need to focus on is that it is highly unlikely that this new vaccine is any weaker against any of these new mutations. So again, the focus is getting these two miracle vaccines out there and into people so that they can prevent the onset of disease. That is absolutely the most important and top priority out there today.
Right.
How long do you think it will take before we can get that 100 million people that you just described inoculated? The CDC came out with new guidelines yesterday and said the next group of people should be frontline healthcare or frontline essential workers, along with people ages 70 and up. That doesn't get down to 65 yet.
Right. It's about 75 and up, and then frontline workers and frankly, I'd say this to all the CEOs out there who have employees and who have factories and who have essential workers. For all those essential workers, particularly the most vulnerable, particularly those who happen to be over 65, particularly those who have an underlying condition like diabetes or hypertension, get them immunized because they'll dramatically change the profile, the lethality of this epidemic. And I want to add that when we look at particularly the scary things that are going on, like in California, in Southern California, hospital capacity is virtually zero at this time. And frankly, the hospitals are filled with people who are more likely to be ill, and those are those very same vulnerables and people over the age of 65. So moving quickly at these vulnerable populations is the best case for reducing the hospital admissions and freeing up the hospital system. And frankly, that's why people put economies into lockdown, because they're worried about the imminent crises of hospital beds not being available and ICU beds not being available. You know, years ago, I was a part of a consulting group that worked for the Louisiana Recovery Authority that helped look at what happened to the hospital after Katrina. And my, oh my, what happens when all of a sudden the hospitals are absolutely non-functioning and people can't get in? It's a really scary situation. So again, focusing on these vulnerables, getting them immunized, getting these people away, not necessarily needing to be admitted from the hospital, creating hospital capacity is something we can do. And frankly, I think we can start to see turnaround in 4, 6, and 8 weeks of this terrible situation by focusing on these vulnerable folks.
That would be incredible. Dr. Levy, thank you for your time today. We'll talk to you again soon.
Okay, thanks for having me on, Joe Becky.